All right, thank you for kicking us off with that. Whoops. Great presentation. It's really important for us to know about the principles that are guiding the practices of forensic nurse examiners. And as we go throughout the presentations today, you're also going to see some practical examples of forensic nursing in practice. And so with that said, I'm going to introduce our next set of speakers. So we are today honored to have with us Tiffany Kafka and Christina Simpson of the Forensic Nursing Service. Unfortunately, Adrian's not here today, but you're going to do an excellent job in representing her. Christina Simpson is the program coordinator for the Forensic Nursing Service at the Abbotsford Regional Hospital within Fraser Health, where she co-leads the regional forensic response for forensic patients, presenting to 13 emergency departments. She has completed a graduate certificate in forensic health sciences and is currently completing her dual focus master's program in nursing and advanced practice leadership with a focus on improving the response to forensic patients within emergency departments. She sits on several local, provincial, and national committees and has contributed to the creation of national guidelines for forensic nursing with the Canadian Forensic Nurses Association. And then we also have Tiffany. So in addition to her nursing degree, Tiffany Kafka holds a Bachelor of Science degree in philosophy/biomedical ethics, a graduate certificate in forensic health science, and is currently pursuing a Master of Science in nursing with a specialization in forensic nursing. She is a director of the Canadian Forensic Health Corporation, providing program advisement, expert legal consultation in matters concerning intentional interpersonal violence, and delivering accredited education and training for healthcare, law enforcement, judicial, and community professionals responding to intentional violence. Throughout her career, she has practiced nursing in the United States, Mexico, and Canada, and she is currently practicing forensic nurse examiner with the Abbotsford Regional Hospital, a forensic nursing service. She's also an expert forensic nurse consultant for the Interior TeleSafe program, and so that's telehealth or sexual assault forensic examinations. She participates as a guest lecturer and presenter for various healthcare, community service, legal, and judicial entities and institutions of higher learning, both nationally and internationally. And she serves on several local, provincial, and national committees and working groups in the development of best practice standards and guidelines in the multidisciplinary response to intentional violence. So with that said, if you two can please come and join me up here.
So I'm going to start today by thanking everyone for coming and learning about the forensic nursing today. I'm Christina Simpson, and this is Tiffany Kafka, and we're going to be talking about the forensic nursing response to violence. Sorry, we're multitasking up here. So we're going to start by looking at who are forensic nurses. So forensic nurses are registered nurses with advanced practice training and competencies, which leads us to be the intersect between the legal and medical systems. So if we're looking at the medical portion of our jobs, we advocate for healthcare and provide any medications that the patients may need if they haven't had them already before we see them. We do continuous assessment for any decline in health status during our examination. We do trauma and violence informed care, as you heard earlier. And we do safety planning, and we ensure post-support services for towards places like Embrace, which you'll hear about later. Within the legal portion of our job, we do evidence collection and chain of custody, maintaining the integrity of the evidence, and we go to court as fact and expert witness. So what makes forensic nurses, in addition to the legal portion, different from other emergency staff? We do have specialized medical knowledge in things like head trauma and strangulation, so we're able to assess for those within our examination as well as help the emergency department identify them. An important statistic within our health authority is that 60% of the patients that present to our program often have a stated event of strangulation, which is very important if the emergency staff aren't able to assess for it, that the forensic nurses are able to meet that need. We just heard about the trauma and violence informed care, so I won't go a lot into it, but what I will say is that the forensic nurses are very good at understanding trauma and stress and collaborating with the patients to do the trust building, giving back control, and empowering the patients to move towards their healing journey. So what is in a forensic examination? So first and foremost, there's consent. We've heard about it a couple of times today, but I'll go a little bit more in detail. We do offer, in Fraser Health, we offer 3 different kinds of consent. So the patients are able to just come in for medical care. If they haven't received it already, we are able to provide that trauma and violence informed lens and make sure they get the medications and tests that they need. We also have where they can get those medical, a second option is they can have the medical portion as well as get the forensic examination and store it for up to 1 year while they decide whether they want to report to police or not. Sometimes our patients are in trauma state and can't make the decision in the moment, so this gives them the option to, make that decision later. Our third option is for the medical care and the forensic examination and for us to connect with the police right away. So we do offer all of those, giving the power back to the patient for them to be able to decide. They can consent to just portions of the examination or the whole thing, and they can also revoke their consent at any time during the examination as well. We perform multiple head-to-toe examinations on the patient. So we do one under room lighting where we're looking for things like injuries and maybe trace evidence to collect. And then we would do injury documentation and photography. We also do a head-to-toe examination under the alternate light source, which is the CSI part of our job. And so we are looking for things like body fluids and semen, so we can collect that evidence as well. All of our samples are collected based on the history that the patient tells us. We do collect clothing if indicated and do an examination of it. And we may do drug testing for blood and urine testing if indicated for things like drug facilitated sexual assault. And then we will do the follow-up and make sure that they get the things that they need after they leave our service. And now I'll pass it over to Tiffany to talk about police reported intention.
Yeah, so the incidence of intentional violence, why we're seeing patients in forensic nursing. So these are 2023 statistics. Stats Canada has not published 2024 yet, but for province-wide, police reported sexual assaults were nearly 4,500 people. Over 1,500 total child sexual violations and more than 41,000 assaults. Now, this is a combined assaults causing bodily harm or with a weapon or aggravated assault as well. If we narrow that down to where we're at in the Fraser Health region, we're seeing approximately 30% of what's going on in the province. So sexual assaults, that's sexual assaults with a weapon or causing bodily harm or aggravated sexual assaults. We're seeing about, in 2023, police reported 30% of what's going on in the province. Total child sexual violations, we in the Fraser Health region detachments, we're actually seeing 40% of what's going on in the province. And then assaults, physical assaults, a little over 12,000, and 30% of those assaults are occurring in the Fraser Health region. Now, if we take a look at what our service would see, which are these patient populations for police reported assaults. Fraser Health, the forensic nursing service, patients were able to access only 252 medical forensic exams. That's less than 2% of all police reported incidents of intentional violence that were seen within the Fraser Health Forensic Nursing Service in 2023. If we bring it down a little more to our own jurisdiction, police reported sexual assaults in Abbotsford in 2023 was 114. Child sexual violations in Abbotsford numbered 69. And all physical assaults, police reported physical assaults in Abbotsford was a little over 1,100. And again, what we see in cases that were able to access a forensic nursing exam. So these are police reported cases from Abbotsford who were able to access a forensic nursing exam in Abbotsford, numbered 24. That's less than 2% of persons who are experiencing intentional violence in our own community were able to access forensic nursing examinations. Now, there's a variety of reasons why people are unable to access forensic nursing. Has to do with staffing. It has to do with multidisciplinary collaboration. It has to do with policing. It has to do with all of us. We work together as a part of the multidisciplinary team to address violence in our community. And indeed, that's what the theme of Crime Victims Week is the power of collaboration. We cannot address intentional violence in our communities or in this province without each other. This is not a law enforcement issue. This is not a victim services issue. It is not a healthcare issue. It is an issue that is a public health and safety epidemic that requires all of us in collaboration, working together to ensure best practices and safety standards for the people who are experiencing violence in our communities.
Okay, so now we're going to have a look at what does forensic nursing look like in BC. So what you can see here is a snapshot of the whole province and kind of broke down what it looks like. As you can see, all of the health authorities, if depending on where you are, might offer different services. So I'll kind of break them down a little bit. So the Interior, who has worked a lot in the last year and a half on their services, they offer just sexual assault. And Vancouver Coastal, who has historically only offered sexual assault, opened a new program last year at Lionsgate to offer domestic violence and interpersonal violence. So that's a move forward. Both of those health authorities have a mixed profession doing the job there. So they do have physicians and nurses. And in the Interior, they also offer something that's called TeleSafe, which is what Amanda referred to earlier. What that is it's a experienced forensic nurse examiner on the other side of an iPad, helping the nurse in the emergency department in super rural areas, getting the examinations they need so that we can meet those needs, because it's really hard to get to those rural areas. In the Northern, they don't have a formal response. They do have physicians that can do kits, but they don't have any formal training, and so they're hit and miss out there. In Fraser Health and Vancouver Island, we do see sexual assault, domestic violence, interpersonal violence, human trafficking, and pediatrics. And both of those programs are nurse-led. So now I'm going to focus more on the Fraser Valley because that's where we're from. So we see patients anywhere all the way from Burnaby all the way out to Boston Bar. So it's a pretty big area. We have 13 hospitals, and patients can present to any of those 13 hospitals and be referred for forensic nursing. And then they will go to one of the two hubs that we have out here. So the two hubs that we have are Abbotsford Regional Hospital and Surrey Memorial Hospital. So patients can be seen at either one of those hospitals by one of our very experienced forensic nurses. I'll just go a little bit more in detail on the people we see. So we do see sexual assault, human trafficking, domestic violence, interpersonal violence, child abuse and maltreatment. Anyone 2 years and older, any gender, within 7 days of the event. They do need to be able to consent to the process, as we've heard, because our consent process is different than healthcare consent. And they do need to be seen by a medical professional first, just so we can make sure that they can tolerate the exam, because sometimes it can take a long time to do an exam. So how do patients present? They can self-present to any emergency department within Fraser Health and be referred after they've received medical care to the forensic nursing. Law enforcement can bring them into the hospital. They can come in with victim services, or we do have sexual response teams out here in the Fraser Valley. They might come in by ambulance. Our UPCCs can refer patients to the forensic nursing as well. And we do also sometimes have patients that come from hospital units. If they come from an outside site, they can be transferred to our site if they're medically stable and returned, or sometimes we can go out on our own sites and see if we can get them an examination. Our services are available 24 hours a day, 7 days a week, 365 days a year. Historically, we have been an on-call service, much the same as the rest of the province. But as you heard, that there is gaps in our ability to provide that care and how it translates into accessibility for people trying to access the service. That being said, Fraser Health has decided it's time for a change, which we are very excited about. Historically, like I said, as an on-call service, we are now moving to have permanent positions within our health authority. So we do have forensic nurses on from 7 a.m. to 11 p.m. at night on site, and then we will have on-call overnight. So we are excited for multiple reasons. We are excited to be able to increase accessibility to all of our communities. We're also excited to be able to lead the way for the rest of the forensic nursing within the province. Yeah, thank you.
Okay, so I have 2 questions in the chat. The first one is wondering if there is a relationship with a scan clinic.
So we do have a scan clinic within Fraser Health. It's called the Health Evaluation Assessment and Liaison Clinic, or HEAL. They do see, and we do refer our pediatric patients there who need to access forensic examinations for further assessment. There is a scan clinic at BC Children's as well. And I do believe in the interior, there is a scan clinic as well. We don't generally refer to the interior because we're Fraser Health, but we do have partnerships and collaborate regularly with the scan teams.
Okay, thank you. And the second question is, what does medical clearance mean, and where/when does it happen?
Okay, so medical clearance means when a patient, like say someone needs to come in and be seen by a doctor before they can see forensic nursing. So whether it's at a urgent care clinic or in the emergency department, but we want to make sure that all of their medical needs are met before we do our forensic examination. Patients can be in doing examination for a lot of hours, and we need to make sure that all of their medical needs are met before that, so that we don't have anything coming up during our examination.
Persons experiencing intentional violence can be injured very badly. We can have life-threatening injuries that may not be readily apparent or visible to others. And so it is important that they do get that medical evaluation to make sure that their body is okay, that they are healthy enough to be able to have a medical forensic examination. And if they do have those life-threatening injuries, that we intervene immediately.
Yeah, things like strangulation, like I had mentioned the stat about strangulation being at high stat at 60%. We want to make sure that those patients, best practice is to get them a CT scan before we get in there to see them. So things like that.
Okay, and the last question from the chat, how long after being drugged can someone do a blood or urine test to confirm?
That's a hard one. Okay, so so we can we can take urine or blood for a drug toxicology at any point, but there is the longer the time goes, the less likelihood that we will find anything. So we also aren't there to say that something happened per se. We're just there to add to the evidence. So we just collect what we can and hope that we get everything. Yeah.
Drug toxicology is really based on the person and their own metabolic rate. We can't say within how many hours. Drugs are kidneys that are functioning do filter that out very quickly. So it's not, unfortunately, it's not often that that the forensic lab is able to see things like Rohypnol or GHB because it's filtered out of our bodies so quickly.
Right, thank you so much. I have a couple more questions. How do children consent to exams? Can guardians consent?
Children do not consent to exams. That being said, in BC and actually in all of Canada except for Quebec, consent is determined by capacity rather than age. So here in BC, we have what's called the Infants Act. If a person, it is reasonably determined that a person can provide informed consent for their care, they can consent to an examination. For kids, a guardian can and does have to consent to an examination for a child 12 and under. However, it does need to be a legal guardian. It can't be, somebody just walking in and saying, I want this to happen. They do have to demonstrate that they are a legal guardian for that child. And the child provides assent. So kids, we can do things for kids until they decide that we're not doing anything for them anymore. I mean, anybody who has kids knows that you can reasonably get them to do what you want them to do until they've decided you're not going to do anything else anymore. And that's how we kind of operate. A lot of kids, they learn through play. We do a lot of play when we do these forensic examinations with kids. I've been on a floor with a dinosaur in one hand and a camera in the other to do an examination. But kids will assent to care until they don't. And then we stop. Oh, and adolescents 13 to 18 can consent for their own care in a forensic examination. They do not need a parent consent, and they do not and if they don't want to have the examination, we will not do the examination even if the parent demands that we are going to do that.
When patients in your region present for care, are they triaged with high priority to speed up the process for accessing a medical examination? And for some context, this individual is speaking specifically to accessing a medical examination prior to getting the SANE examination.
Yes, is the short answer. They are triaged at an urgent level of triage, or what in the Canadian triage system is a CTAS 2, meaning they do have priority ahead of a lot of other patients presenting to the emergency department.
How many forensic nurses are there in the Fraser Health region?
So currently we have 29 nurses practicing in the Fraser Health region, 20 at Surrey Memorial Hospital and 9 in Abbotsford. And of those 29, 7 have also the advanced education and training to be able to provide pediatric examinations for 12 and under.
Great, thank you very much. So we are very lucky here in the Fraser Health Authority to have some very qualified forensic nurses available to do these examinations. Okay, that was great. Thank you so much. We encourage the questions. Those were excellent questions. Again, please take the opportunity to ask the questions that you've always wanted to know the answers to, because the experts are here in the room. Continue to post those questions in the chat, fill out the cue cards here and pop them into the folder or in the drawers there. And we'll make sure that we get a chance to answer those questions throughout the remaining portion of the day. We are just going to take a quick 5-minute break. We have our service provider panel coming up next. So we have a number of service providers here from the Fraser Valley who are going to talk about the importance of access to forensic medical exams with their patients. So we'll just take 5 minutes to get the stage kind of reconfigured here. So we'll get going again at 10:37. Thank you.